bleeding time and clotting time. We are discussing hematology, this in the hematology theory sessions about hemostasis and coagulation, and we will continue with mechanism of anticoagulants and all. So this is related to that topic. That's why we have arranged for your convenience this practical. So bleeding time, we are studying platelets. Bleeding time measures. Bleeding time, what it is, nothing to write here. Everything is there. Follow any practical textbook. In my opinion, Dr. A.K. Jain's textbook, and now I will suggest Dr. C.L. Ghai's textbook. If you get a reference from the library, and at least if not the current edition hard copy, you search for the soft copy. 8th edition soft copy is available on the internet. Okay, for free. That is for free. So that will suffice. So because questions and answers are given at the end of each topic, such that it will prepare you. If you just read about the practical topic, it will prepare you for the theory, at least some theoretical aspects of that topic. Every topic you perform in the hematology examination, during the examination, theoretical questions should be asked. The thing is that if the experiment result, at least if not the result, if the experiment is not done properly, then probably you are not getting any credit, or very less credit. You get very less credit, and if not at all, if you perform the wrong experiment, as I am telling you, questions won't be direct. In case of BTCT, it would be direct, estimate bleeding time and clotting time, or in case of blood grouping, it will be say direct, determine the blood groups, state the Lansstein-Aronson maximum. But in case of differential leukocyte count or hemoglobin, like in case of differential leukocyte count, it can be like that. The total leukocyte count is given and you are asked to write the number of neutrophils. So you have to do the differential leukocyte count. If it is say neutrophils, you have counted 100 cells. Then if it is 60, you have got 60 neutrophils. Then you have to write 60 by 100 into that number of the total count. That gives you the number of neutrophils. So you have to do that. So if you can't perform the experiment, then you are not getting the result, and there is actually no scope of asking relevant questions. But relevant questions are, as far as I have seen among all these textbooks which are going on in the market, the book by Dr. A.K. Jain and also other books, book by Dr. A.K. Jain is a colorful one, and that is eye-catchy for the beginners. Sufficient information is given to perform the practical, but questions and answers, I'll say the book by Dr. C.L. Ghai, lot of questions and answers, lot of discussions which prepares you for the theoretical topic as well. At the end of this topic, questions and answers are given which almost prepares you for this whole of the hemostasis and coagulation topic. That means the coagulation pathways and all are, it is written in the form of those questions and answers. Obviously, you can read from any source, it is all knowing about the topic, but I would suggest this. So follow that book. It has already been 2 months into this course. Those who are new, just try to get acquainted with it. So at the beginning, I had told that start with any one book and then refer to C.L. Ghai later. It is best. Actually, what happens is that the students first come in touch with their the immediate senior batch. So if you take their suggestions, many suggestions will be good as well. But you see what themselves they are in a position like this. So take suggestions from your faculties as well. So actually some books are going on, these are becoming common, that some books are going on in some areas, other books in other areas. That is then obviously that happens. But still, if you have bought any other book, try to get a reference from this book, and this in these days of internet it is possible. So get one edition back, but study. So bleeding time is, no need to write this. This is given in any textbook, theories as well as practicals. What is bleeding time? It is the time from the skin puncture. In some books it is written skin puncture, others it is written from the time of injury, at the time, from the time of the wound is happening, whatever you do, from the time of the skin puncture to the arrest of bleeding. This last word, arrest of bleeding, is important. Why? Because clotting time is the same thing, but up to the formation of the clot, and in practical terms we will see a fibrin thread. A fibrin thread can be noted. This fibrin thread means fibrin monomers and fibrin polymers has been formed, just what was discussed in the last class yesterday, those who were there. So don't miss classes. So many a times we try to keep the theory and practical topics aligned. Always it is not possible, but sometimes we at least try. Often we try. So arrest of bleeding is one thing. Arrest of bleeding. Bleeding is no more, blood is no more coming out. Like you prick your finger in the lab. So blood is no more coming out, and formation of that definitive clot is the next thing. It is within a matter of minutes, within a matter of few minutes, 2 minutes, 3 minutes. This arrest of bleeding by the platelet plug, which is, all of you are there in the class yesterday? All of you? So formation of the platelet plug, primary hemostasis is this is corresponding to this arrest of bleeding. So bleeding time measures this platelet, usually measures this platelet, usually not, the bleeding time measures or estimates this action of platelets. That means quantitative or qualitative. Quantitative means quantity, that means platelet numbers, or qualitative defect. In qualitative means platelets are there, but there are some defects in platelets that they cannot act. This is the difference between the term qualitative and quantitative. Qualitative means what? Quantitative means what? So these terms you will get in books. You may write down that these terms you will come across many a times in many topics, and you have to know the qualitative. Wherever you find the term qualitative, that means it is referring to the quality, that means the nature, qualitative nature, quality of that. There are platelets, but they are defective. Quantitative means they are affecting the number, something relating to the number. Affecting the quantitative, referring to the quantity. If platelets are low in number, how can platelets perform their action adequately? If platelets are even high, normal or even high in number, but they are defective, that is qualitative issue, then how can they act? So bleeding time estimates platelets. If platelets are either quantitatively low or platelets are normal in number, even high in number, but cannot act, then bleeding time will be affected. So, and clotting time will measure the clotting factors, estimate the clotting factors as well, like very classical example which you have known from your school level knowledge, that hemophilia occurs because of deficiency in clotting factor 8. So in hemophilia, which will be affected? Clotting time will be affected, because it is due to a clotting factor. Just measuring bleeding time and noting the time up to the arrest of the bleeding, we will see how. Just so it will not be affected, probably not be affected in hemophilia, but clotting time will be affected. Okay, because it is, hemophilia is due to the clotting factor 8. As of now we know this, it is actually due to two more. We learn about this in the next session. Hemophilia A, B, C. There are types A, B, C. A is due to clotting factor 8, the most classical type of hemophilia. So bleeding time, how do we measure? Actually do it in the lab. So very simple experiments. These are very simple experiments. It takes few minutes from entering from the examination purpose. I am telling from the examination point of view, entering the examination hall, reading your question, asking for the apparatus. As soon as you get the apparatus, within few minutes this experiment is done. That is, you have to prick your finger according to the measures taken. Here it cannot be done with venous blood. So it will get more complicated. So prick your finger. Prick should be single and deep prick. Adequate measures, that means precautions are to be taken. Drying, why is drying after applying spirit and cotton? Why is drying required? There are two reasons. What are the two reasons? One is that because in the spirit or that alcoholic solution, alcoholated solution, if this get mixed, how will the results come? Blood cells are not present. Bleeding time, I am measuring the arrest of bleeding, I am measuring fibrin thread. Fibrin threads won't be present in tissue fluid or spirit. So we can't press, it has to be a single deep prick. One reason for drying is spirit does not get mixed, but the first reason the antiseptic action comes only after a certain time. That is, Not certain time means maybe 30 seconds, 45 seconds, but we have to at least allow that time. If we allow it to dry, that time is automatically elapsed. So that those are the two reasons. One is the antiseptic action, which is my primary, that means reason for which I am using this spirit, and second is that spirit itself does not get mixed with the blood. So those precautions are taken, it is pricked, blood is flowing out. As soon as starts blood flowing out, you have to note the stopwatch. Again, from the examination point of view, mobiles are not allowed in the examination hall. So mobile, don't think of mobile stopwatch if it comes to your mind. If you have to keep a watch with the seconds hand, and otherwise it is with the, you have to keep a stopwatch. Okay. So any one of these things is required for bleeding time. That means the time is to be measured from 0 time. 0 time is as soon as the blood starts to come out. Now, as soon as the blood starts to come out, you have to stopwatch has to be switched on and put one drop here like this. Before that, for the beginners, it is suggested along the sides write 1, then 2, 3, 4, 5, 6, 7, 8, 9, 10. I will suggest at least up to 10. This is for the beginners. This is actually not required. Number of drops are important, but writing 1 means I will put my first drop at 1. Then after 30 seconds, I will put a second drop. Bleeding is still going on. Second drop at 2, third drop at 3, and so on. So estimated theoretically, that means experimentally, it has been seen by this method. This is called Duke's method. I have just can't recall the first name right now. Duke's method. So this method, experimentally it has been seen. Usually the time varies from 2 to 6 minutes. Bleeding time. What? Up to the arrest of bleeding. How will the arrest of bleeding be understood? Simply I will get no more drop. So the expected result is the drops will go on decreasing in size, platelets are working, and finally there will be no more drop. So I have labeled 1 to 10, say the drop, no more drop is there, that means I touch the finger, this filter paper is touched to the finger, but the bleeding is occurring, there is no spot, there is no bleeding spot. So at 7. So what is the gap? 30 seconds each. I am noting by the watch, 30 seconds each. So 30 into 7 is 210. So bleeding time is 210 seconds, that is 3 minutes and 30 seconds. 3 minutes and 30 seconds, right? Similarly, for clotting time, what I do is, these are lancet needles and cotton and spirit which are required for pricking. Clotting time, this is a capillary tube. This is called Wright's method. Again, I can't recall the first name right now. Wright, W-R-I-G-H-T. Wright's method, Wright's capillary tube method. Some A Wright. Okay. So Wright's capillary tube method. As soon as bleeding starts, we note the time, prick the finger. Here, it is not to be touched repeatedly. Just touch once, and blood is sucked in the capillary tube by capillary action. To aid any gravitational aid, we usually keep it like this. Capillary action occurs even if we keep it like this, just to aid it with the help of if any gravitational aid. So keep it like this, that this is facing downwards. Okay. So just blood will be sucked. Now I have noted the time, that is 0 time. So it is written in books, wait for 1 minute and then start breaking a small piece from where the blood is sucked. So blood is sucked up to say this. So break small pieces from here at intervals of 30 seconds. So what we see, I have broken a small piece, keep it on the table. That means your working area. Okay, carefully keep it. It should not be lost. I'll tell you why. So small pieces. So keep it carefully. After 30 seconds, break another piece, and a time will come. So count how many times you are breaking. That counting will, this number of pieces will make you that how many pieces I have broken. One time will come when you have broken a piece and you can see a thread-like structure. This is theoretically actually the fibrin thread. So when the fibrin thread has formed, say you have broken 7 pieces and you are breaking the 8th piece, after that you keep it 8 piece fibrin thread, or 9th piece. So it's 30 into 9, 270, or 10 pieces, 30 into 3 and 300. So it is 5 minutes. So what is your result is 5 minutes. Now what this is written in books like this, 5 minutes, but clotting time is actually, it is written in books like this, wait for 1 minute before starting breaking it. So actually clotting time is not 5 minutes, 5 plus 1 is 6 minutes. Now what is the reason for waiting 1 minute? Any idea? What is the reason for waiting? Clotting has started as soon as it is 0 time. That means clotting, obviously we are telling fast platelets act, then this comes into action, platelets form a primary hemostatic plaque, then the clotting factors come, either factor 12 or factor 7. From your knowledge of yesterday's class, will it be, which is more possibility, factor 7 or factor 12, which will act? In this case, which clotting factor? What was where did I keep it? This is the problem. So this is, yes, here. You have to keep it very carefully, because if you keep it on a surface like this, it may get lost. So pieces have to be kept very carefully. Maybe even on one side of your answer, it is not recommended that you keep it on an answer sheet, but you have to keep it carefully so that these are not lost. Okay. Which clotting factor will initiate the clotting cascade in this case? Factor 12 or factor 7? Factor 12 is one pathway, intrinsic pathway. Factor 7 is extrinsic pathway. So why do you think factor 12 and not 7 in this case? In this case, actually yes, tissue, because tissue factor is there. Bleeding is occurring, blood itself comes in contact with the tissue. So factor 7 will be there. But here primarily factor 12, because factor 7 will be there in each case. So what happens in the body inside the body, and what happens here? Inside the body means inside the body, not inside blood. So we had discussed that the difference is intrinsic and extrinsic terms depend on whether it is within blood or outside blood. Extrinsic is obviously inside the body, but outside blood means extravascular. Tissue factor comes from the tissues. So blood is coming in contact with the other tissues before coming into this capillary tube. So factor 7 will also act, but this is specifically, if not glass or siliconized anything, it is not actually glass, but capillary tube, this is not actually glass, but the name is glass contact factor, factor 12. So factor 12, it initiated more, that takes the primary, that is the primary pathway when it comes into contact with surfaces like this, surfaces or this. So this will activate factor 12. Inside the body, which is more inside the body, that means when actually a wound happens, which clotting cascade is getting the upper hand? Which is with the factor 7, because immediately after bleeding has occurred, that means blood is coming into contact with other tissue, it comes outside the vessel. So tissue factor 7, tissue thromboplastin factors and factor 3. So factor 7, factor 3, these are getting involved. Here glass contact factor, factor 12, and also those factors. So both pathways, but primarily factor 12. So factor 12, the clotting cascade is going on right from 0 time. We are talking about platelet plaque formation, then secondary hemostasis, that actually a matter of some seconds. That actually this hemostatic plaque and all matter of some seconds are already, when the arrest of bleeding is occurring, which you are measuring by bleeding time, already the clotting cascade has also initiated. So all these are just related, but to explain, we are saying, explaining it differently. So why do we wait for 1 minute? Scientifically, it is not required. It is not that before 1 minute, no clotting factor is coming into action. It is not like that. We wait for 1 minute. This is just for economic purpose. That suppose if we have 3 capillary tubes, 4 capillary tubes we want, we can draw blood in as soon as bleeding starts. We can draw capillary blood into 4 capillary tubes, 5 capillary tubes. Because I don't know, we go on breaking pieces, when fibrin thread will be formed, I theoretically don't know. I am estimating that, right? So maybe one capillary tube is not sufficient. Someone's clotting time is prolonged. But for the purpose of as beginners, you will be doing on your own blood. We are considering ourselves as healthy people whose clotting time is not prolonged. Clotting time is normal. It is usually seen that one capillary tube is sufficient. And why I wait for 1 minute? Just that if somehow not sufficient, that 1 minute ensures that lesser pieces are required, right? Now you can ask, then I may wait for 4 minutes also, but that will 4 minutes, the clotting time itself may be less than 4 minutes. So that will save my pieces. I wait for 3 minutes and then start breaking. Maybe I get 2 pieces. 2 pieces means 1 minute, 30 seconds, interval 1 minute. So 3 plus 1 is 4 minutes. I write my answer. But if I wait for a longer time, it may happen that fibrin thread is already formed. So if already formed, then I cannot estimate the time. I break the first piece, fibrin thread is formed. How can I estimate the time? I have waited for say 6 minutes. So whether it was 4 minutes or 5 minutes or it is actually 6 minutes, it is not possible to. So within 1 minute it will not happen, assuming that we wait for 1 minute, but we can actually break from 0 time. Okay. In case of bleeding time also, if I can note a watch, I add 1 to that, 1 minute to that. Okay. So, but that is not required because I can I have one filter paper is sufficient, and if I label up to 10, that is 5 minutes, it is sufficient. Actually, I may label up to 10 or 20 if it is prolonged also, so it will not be usually greater than 6-7 minutes. But actually, theoretically, till I find it, my aim is to estimate the bleeding time and clotting time by the experiment, not think of the what is expected theoretically and match the answer with that. That is not the objective. So as beginners, you label it. Usually you people are healthy, you are just trying to know about the experiment, you are trying to have knowledge about the experiment. We are assuming we are ourselves healthy. So bleeding time will be within the theoretically expected range. So if it, even if it is 6 minutes, then at intervals of 30 seconds, how many will be required? 20 drops. So you label 1 to 10, you may label 11 to 20, no need of labeling if you just can't remember that first drop is this, second drop is this, third drop is this, that is also not required, this label. Okay. Now thing is, we are, what we are saying, say 10th drop is not there, say 10th drop is not there, up to 9th drop there was, drops were becoming smaller, 9th drop was there, a small mark on this filter paper, but not the 10th drop. So what is the bleeding time? 13 to 10, 300 seconds means 5 minutes. Now just think, some books are writing, or even if instead of 30 seconds we can put it at an interval of 15 seconds. If we put it at an interval of 15 seconds, then say we get 20 drops, it is again 5 minutes. Okay. So the 19th drop is there, very small, but 20th drop is not there. As we go on increasing the frequency, that decreasing the frequency at which we will take the drops on the filter paper, blood drop on the filter paper, what is increasing? The accuracy. Now I can say the bleeding time is 4 minutes 30 seconds. In case of 30 seconds gap, I can say at a maximum interval of 30 seconds. It will be a multiple of 30 seconds. The answer will be a multiple of 30 seconds. But if you can take at intervals of 15 seconds, it is possible to get an answer which is a multiple of 15 seconds. You get it? I can say it is 2 minutes 15 seconds, or it is 3 minutes 45 seconds. Okay? If I can take at an interval of 10 seconds, we can say at multiples of 10 seconds, it is 3 minutes and 30 seconds. 30 is possible with 30 second gap also. 3 minutes and 40 seconds. If we take an interval of 10 seconds. But again a question arrives, then why not taken at an interval of 1 second? That is humanly not possible, because it is every second it is not possible to touch. So keeping that, I'll use one filter paper and it will be sufficient. We usually take at 30 seconds or 15 seconds. If you do as beginners at intervals of 30 seconds, it is sufficient. Okay, we can take at 15 seconds, not even 10 seconds interval, just noting the watch. And obviously number of drops will go on increasing if we take at less intervals, and then again the economic question comes, we have to use more filter paper probably if we go take more less frequent intervals at less frequency. Now suppose we are taking it at 30 seconds, so we are telling answer is see, two filter papers, so you can use two, maybe we are having a, if we label it earlier, we can write 1 to 3, 1 to 10, 11 to 20, 21 to 30, 31 to 40 and so on. So more filter papers will be required if we take at regular intervals. Now just think, say 30 seconds gap we are taking, so 30 seconds, 10 drops, 3 minutes, that means 10 drop is not there, so bleeding time is 3 minutes. Now do you know, that means 300 seconds at the 110, 30, at the 270th second there was a drop, however small, whatever small it is, very small mark, but there was a drop at 270 seconds. But at the 300 seconds there is no drop. And what I am writing it as my answer, books are also writing it, if you write 300 seconds it is okay, the answer is okay, my bleeding time is 300 seconds or 5 minutes. But do I know whether the bleeding stopped at the 271 second or the 299 second? We are measuring in seconds. I have a second watch, not a millisecond watch. 1 second is 10 milliseconds. That is not humanly possible to measure. So I am measuring in second. I don't know whether it stopped at 271st second or 275th second or 279 second or 282nd second or 284, 280, 90. It may be, but I am getting at 300, so I am writing the result at 300. So in my opinion, it is better. It will be a better answer if you say the bleeding time is between 2 minutes 30 seconds and 3 minutes. Do you get it? I don't know when the bleeding, at which second the bleeding has actually. The bleeding time is somewhere between 2 minutes 30 seconds and 3 minutes. I have, as I had took at 30 seconds interval, it is 2 minutes and I am telling it as 3 minutes. If I had taken at 15-second interval, maybe there would be no drop at 200 and say this 85. 285 seconds there would be no drop. That then I could tell the bleeding time is somewhere between 270 seconds and 285 seconds. If I took a 10 second interval, it is somewhere between 270 and 280. So if you do at 30 seconds, it is better to say it is between 180 and 240 or 270 and 300 or 120 and 180. 120 is just 2 minutes, probably it will be greater than that, but it is between 2 minutes 30 seconds and 3 minutes. Similarly, you may answer for clotting time. Fibrin thread I am noting at 5 minutes 30 seconds, but it is actually between 5 minutes and 5 minutes 30 seconds. So I have not seen it written like this in books, and I personally have not seen it. There are so many books in the market, I have not seen books, all books obviously, but it is written in books. Take the time which you have noted, but it is a better answer if you take that time between that, the last spot and where there is no spot. So these very simple experiments, simple to understand, but to perform again, pricking should be, if not perfect, pricking should be such that it is a clean, deep, single deep wound. Otherwise you have to press and that ruins the experiment. If you have to press for taking out blood, there is tissue fluid and all, and tissue fluid does not contain fibrin thread, and all these thing again will come into it does not contain cells, it does not contain the, that will not contain means it will not form the fibrin thread. Nothing, blood does not contain the fibrin thread is formed, so it will not be formed and it will not give you result. So that prick step is important. Then it is simple, easy and simple. So during the examination point of view, if you are both BT and CT, probably another question will be there with it, because the time is 45 minutes. Those who get DLC or maybe which will total count of RBC and WBC still not done in the class. So total count of, so they will require almost 1 hour, 45 minutes, 1 hour. But for these things, maybe along with it, the question will be blood group, BT, CT, all you have to do. So 3 experiments in 45 minutes, and it is easily possible. These are shorter experiments, or maybe hemoglobin along with blood group and clotting time, or hemoglobin along with at least one of these, bleeding time or clotting time. This will be your for the examination. So only BT and CT, don't expect that you, because the time allotted, you enter the hall and you can come out of the examination hall, that means the hematology examination lab or examination hall, after 1 hour, after the whole batch will come out together. So 3 experiments are given, and as these are shorter experiments, hematology is a scoring area. If you do your experiment, get your result, and you answer well the related questions. In this case, the related questions are on this hemostasis and coagulation on platelets. So related questions, then hematology is a scoring area, and if this is divided into, like, this is on the examiner, say if blood group BTCT, he is thinking idea for 4 marks, if it is 10 marks, 4 marks allotted for blood groups, 3 for bleeding time, 3 for clotting time, and obviously it becomes like a question, that means where it is divided into parts, it becomes more scoring. From the examination point of view, it becomes more scoring, and these are simple to perform, and if you know the related theoretical aspects, maybe even scoring full marks is theoretically possible. Okay, so just remember these things and read out the topic. That is my suggestion from the book by Dr. C.L. Ghai as well. All topics which have been discussed till now, including the clinical topics, refer to that book. Already it is 1.5 to 2 months. For today, it will take, say, maximum 30 minutes after you go to the lab. Perform, but perform well. This prick part is very important, pricking part, collecting capillary blood. If you fail in these, then you won't obtain the result. And after the class, write it down. I had already told you, write out to blood groups. So what are the topics? First topic is study of the compound microscope, then preparation and staining of a peripheral blood smear, then identification of cellular components of blood under microscope. Platelets are not required as per your syllabus, and strictly speaking, platelet is not cells, leave that, cell, it is cell fragments, but still identification of cellular components, mark RBCs and the different types of WBCs, draw diagrams, relevant diagrams, then differential leukocyte count, which is actually the topic for the examination. Differential leukocyte count, without preparing and without staining a blood smear and identifying cells, it is not possible to do the count. So differential leukocyte count, then estimation of hemoglobin, determination of blood groups, estimation of bleeding and clotting time. These should be the order, and give 7 or 8 dates, separate dates, but don't give any date, as it is an official document and marks are allotted for it. Don't give any date before your date of joining. Remember that. So I think all of you have at least 8 dates. If actually clinical classes have taken place, no problem, but those 8 dates within Wednesday and Saturdays you give. And if you have attended from November onwards, first 24th October onwards, then give the actual dates. But if there is anybody there, then inform us that I don't have dates after 8 dates after joining. I'll tell you what to do. Differential, the first 4 topics, study of the compound microscope is 1 date, but the topics staining, identification and DLC, as that is the topic as given in the syllabus, that can be given written on 1 date. But for the convenience of learning, we do it on separate dates, otherwise students face problems. Staining is itself on the first day, in 1 day, it is difficult to learn. So we took time from it, almost 3 weeks to 1 month we had spent on DLC itself, staining part, then identification part. So give these 8 different dates after your date of joining. Okay, if actually clinical classes have taken place, that is no issue. Okay, but before your date of joining, obviously don't give any date. Wednesday and Saturdays after your date of joining, except 25th December, which was a Thursday, and the Sundays, there was no academic holiday. So classes have taken place, so there is no problem with that as well. Classes have not taken place just from 24th to 27th because of college program. 25th was already inside that. So 4 days. So don't give the dates as 24th and 27th. You give the actual dates. Actually, those who are attended from the first, give the actual dates. Right? Like today's date is 31st of December. Right. So proceed to the lab. On Saturday, we will be discussing some. That means some clinical topic will be discussed, because again we are estimating it. If by chance if it is half filled but still the result comes, is okay, but it is suggested that it should be filled completely, and it is suggested if it is longer capillary tube then it is better.
पिपेटिंग करना नहीं है ये पर पहले दिन कोई कर रहा था.
Yes, what is the difference between a tube and a pipette? I forgot this in the demo room yesterday also. You have done hemoglobin, you have seen the tube, so what is the difference between a tube and a pipette? Structurally, we suck with the pipette, so very common sense, it is open at both ends. Tube, hemoglobin tube, we have seen it is closed at one end. This is open at one end, but still named a tube. Somehow, some type it can be called a misnomer, but this is a capillary tube, it is called, not capillary pipette. We don't suck, we just draw by capillary action, hence it is called capillary tube. In one way, if we go by a definition, it's a misnomer. Okay? It is open at both ends but still called a capillary tube. But actually, what we have seen in hemoglobin experiment, tube is closed at one end where you ultimately perform the experiment by putting the blood, acid, N/10 HCl, that. And pipette is what you suck with, that has to be open at both ends. That is the structural difference. ওটা যদি তোমার এয়ার বাবেল থাকে
তবে এতটা ছিল এত তুমি ব্লাড ডিপ পিক হয়নি তার জন্য
অতটুকু করলে হবে না, মানে ব্যাপারটা সেটাই, ইট শুড বি আ, সুতরাং প্রিকিং, ইট শুড বি আ সিঙ্গেল অ্যান্ড ডিপ প্রিক সো দ্যাট দ্য ক্যাপিলারি টিউব ইজ ফিল্ড কমপ্লিটলি। ওই দুবারে করতে গেলেই অসুবিধা হবে।
স্যার পিক করে কি মানে এমনি ডাইরেক্ট রেখে দিব?
রেখে দিলে ক্যাপিলারি অ্যাকশনে চলে আসবে, তাও গ্র্যাভিটি এ পেতে চাইলে এরকম ভাবে ধরো যে হ্যাঁ
ঠিক আছে, যে এই জিনিসটা জানো তোমরা যেটা করছো আঙুলে এই হবে, তাহলে কি বলতো ব্লাড এখান থেকে সাক করে এই সাইডে আউট হয়ে যাবে।
এটা তো একটা বোথ এন্ডস ওপেন না, এগুলো তো কমন সেন্স জিনিস। জাস্ট স্লাইটলি টিল্ট করো, সোজাও ধরো, তাতে ক্যাপিলারি অ্যাকশনে সোজাই চলে আসবে। হোমওয়ার্ক বলে একটা জিনিস হয়, তো হোমওয়ার্ক করার জন্য তোমাকে নিজে নীল রেখে তোমাকে প্রিকিং প্র্যাকটিস করতে হবে। দুটো স্লাইড রাখতে পারলে স্মিয়ার ড্র প্র্যাকটিস করো। জীবনে একবার এসে পরীক্ষা হলে প্রিক করবো তাহলে তো হবে না, হবে না, ওটা ওইভাবে ডিপ প্রিক হয় না। এইরকম ভাবে নিয়ে এইরকম ভাবে ছোঁয়ালে যাতে ব্যথা না লাগে সেইভাবে এক্সপেরিমেন্ট হবে না। যেভাবে ব্লাড নিতে হয়, তোমার ভেনাস ব্লাড যদি না হয়, ইনজেকশন প্রিক করি তো না হয়, সেইটুকুই পেন হবে, তো তার জন্য ভয় পেলে হবে না। প্রিকিং এর মানে সেটা প্র্যাকটিসের ব্যাপার, তবেই সেই ভয়টা কাটবে। ওইটাকে ধরে কি হবে, ব্যথা কম লাগবে, ওটাকে ধরারই কথা নয়, প্রিক করার সময় ওটা ধরার কথা। এই রকম ভাবে ওই তো বেরোবে তারপর টিস্যু ফ্লুইড। ও বাংলা বোঝে তো না? বোঝে না, বোঝে না, ওকে। You can't hold it like, you should not hold it like this, because to be already for taking capillary blood, as the blood is flowing in the body, that will help you to, so you have to keep the finger like this and prick as it is. The prick should be deep. There is no, actually there are measurements, but that is not practically, we don't consider it. Just deep prick so that the blood flows freely, that is the objective.